Okay.
Hi, everyone. I am Dr. Veronica Riera-Gilley, and we are here tonight, or today rather, talking about embracing mortality. And I am joined by my friend and colleague, Monique Claudio. And the topic we've chosen tonight to talk about is the myths of aging. So, Monique, will you tell us about yourself?
Oh gosh, there's so much to tell, but ultimately, as it relates to this topic and our relationship, I've been on a lifelong journey to essentially sovereignty and autonomy, like living life fully from my own terms. And then through that process, learning how to share that with other people because it's been so beneficial to me. So you and I met through another really awesome being who was here in Costa Rica, Dr. Jenna Clack. And it's been really an interesting journey for me. So I grew up in a kind of suburban place, Long Island, New York, kind of the border between Long Island and Queens. I lived right near the beach. And I had one of those childhoods that's kind of like, there's more a rumor of these now these days, where I was kind of a latchkey kid. I got myself on rollerblades starting at age 10, everywhere I needed to be. And because of some stuff that was going on in my household, I eventually found fitness as my therapy, right? As my outlet, as a place to like have a little bit of control in my life and start to learn about myself in the world. So I rollerbladed everywhere as my transportation. I started working out at a gym with a personal trainer at like 14, and started realizing that I liked it. I liked having that ability to really like work with my own body and to do things that seemed really challenging and push myself. And eventually that set a lifelong, passion for physical fitness, for health and wellness. So I ended up, when I went to college, getting an in-house certification as a personal trainer at the student gym there. And that meant that we could do personal training, adhering to the guidelines of the American College of Sports Medicine, with mainly faculty and staff at the university or other students. So it was in-house, it was only there. But the beauty was, in the meantime, I jumped around having a bunch of different declarations of majors. I started as an art major, and then I shifted into English with a film concentration. And then I realized I didn't like the English major, I just liked the film stuff. And I looked at my transcripts and was like, you got to graduate at some point. Like, you got to get out of this place and you're going to need to do one of those job things, right? I always worked part-time. I was very self-sustaining. I came from a household that wasn't very financially or, fiscally flexible. So it was a lot of it was on me. I had, jobs when I was very young, so I knew how to hustle. And eventually I went, okay, psychology. I have enough credits there. And I think I really, really like those classes. So I graduated with a degree in psychology. And then right around the time I was graduating, I also said, this fitness thing, I do like it. I don't know if I want to do anything with it, but maybe it's good to have it to fall back on if I need to. So I went ahead and got a certification with the American College of Sports Medicine. I just took, a test on a weekend at a university, but I had been groomed for this for, the better part of a decade at that point. And so I got a certification that at the time was a health fitness specialist. This was before there were personal trainer, certified personal trainer options. That certification, if you were to look it up, actually they changed it. They did like an audit and they decided to change the name of it. So then I was a certified exercise physiologist, right? So now I have bachelor's in psychology. I'm an exercise physiologist, all fancy ways of saying I know some things about how the brain, the body, and our minds and our physicality work. And I worked in a clinical setting, psychiatric unit in a hospital in Wilmington, Delaware, and I was doing fitness on the side. So there was a local Y right across the road. I would teach some group fitness classes there. And then I had a private personal training gig elsewhere. And I started to see, because I was working in a hospital setting, I started to really see the limitations on basically my tier of staff, like where I was in the hierarchy. And for anyone who works in the medical field, I don't know how it is now because I haven't really worked in that field directly for some time. However, there's always been a little bit of like a sort of peaking order. And so it's sort of like you have your doctors at the top, you have the nursing staff somewhat kind of a little bit more expected to relent to the choices and the decision-making power of the doctors. And I was beneath that, right? So I was what's often known as a tech, but in that setting, I was a mental health associate. And the requirement for that job was a degree. It also, if you didn't have a degree, you had to have some experience in those settings. And I started getting disillusioned with my job. I loved the work. I was fascinated and really enjoyed some of the difficulties of what you saw in people who were essentially acute care, often suicidal, really, really having trouble. We had a lot of older patients who would come in from nursing homes, and maybe their medications were off, so their behavior was erratic, or it was exacerbating other disorders that they might or diseases that they might have gone in their chart. And then I also would pick up some side shifts working with patients on other floors who were in restraints and couldn't be brought to the psych unit because they had other more serious things going on. Sorry, my dog's in heat, and there's another dog that's been hanging around. Hold on one second. So that'll make this lively, right? Nature doing its thing. This is my dog. He's gonna join us now because we don't want puppies, and I don't know if that dog is fixed. But ultimately, it was really interesting what led me out of that environment. And it was frankly my intelligence being insulted by a supervising staff member that day. Like, it was the straw that broke the camel's back. But there was also this recognition that something was missing. There was something going on in that environment that it felt like we were managing people's situations, their mental health. We were managing illness, but we weren't really creating change or giving people real power back. And there was no education necessarily because, the proverbial hands tied sort of situation of trying to compartmentalize mental health, which is really whole health. It's really a symptom of what's going on at the level of the soul, as far as I'm concerned, and lifestyle and environment and relationships. And so it just felt to me like there was this desire in me to help and to give to the world was not really being best utilized in that environment. And I had at that time been offered a position at a boutique personal training studio, and I took it. And it was like taking a real leap of faith. Fast forward to, I was at that job for the better part of 9 years. And there was still something missing in that environment as well. At about the 4-year mark, I started comparing myself to other trainers and couldn't really find a big disparity. It was like, well, I'm doing what they're doing, but I'm noticing something here. I'm noticing that some of my clients are super stressed out, and they're leading these lives that are just breaking their bodies down. And now they're coming to me and expecting me to make them stronger and healthier. But I'm kind of fighting a little bit of a losing battle here unless they want to change bigger habits. So this relationship of being a personal trainer was a little confining in that environment, in that specific environment. I've also always been a little bit of a rebel or a misfit, and I did not fit in a very conservative, the clientele was highly educated and very wealthy, which is awesome. It also meant that there was a little bit of a country club mentality, and I'm kind of a free spirit. I would say I kind of vacillate between, science geek and hippie. And so there started to be a disconnect for me, really living out like the fullness of what my offerings were. And I've always been very intrepid because I was left to my own devices as a kid. It was like, well, what do I want to do with myself? Where am I going to go? What do I need to get there? So I looked at some of my hours and realized, I have some downtime. I have a lot of dead time in the day. As a personal trainer, you're up early, you're working late sometimes, a lot of times in those environments, because you're working around people's work schedules, 9 to 5 work schedules. So all the while I was picking up some corporate gigs and little one-off gigs here and there. I worked in a department, a subsidiary of DuPont, doing some ergonomic strength and stretching work for scientists so that they wouldn't have overuse injuries from pipetting for, scientific purposes. And then I started getting trained to teach yoga and started seeing what I was already doing as a personal trainer through a very different lens. I started understanding a little bit more about how breathing, and now I think more personal trainers have understood this. Breath work in general is pretty popular now. Everyone knows who Wim Hof is. I was kind of cool and different when I hung out with him and did a workshop with him. But basically, I started seeking out different information. I started running barefoot and playing in the woods and getting much more connected to my relationship with nature. I started dealing with my inner turmoil and my patterns and my childhood. And as I was doing this work, I realized, wait, I can teach this to other people. And in this, I also learned a technique called the MELT method, which is our connecting point, which is a fabulous approach for helping the body come back to balance and really reclaiming this sense of deep knowing within ourselves. There are pragmatic steps and tools, so it's accessible to all bodies, all budgets, all walks of life, all age groups, all athletic abilities. In fact, a lot of the moves that you and I were working on that I coached you through, they can be done in a bed if you're not feeling well. So it was that and a number of other things like the yoga practice and being outside in nature that started to peel back all of this conditioning I learned from a young age, that I need a professional to teach me how to do anything, right? That I need the person with the expertise. Yeah, if I want to refine my skills and go really deep, it's good to have a guide. But I realized I have everything I need within me. My body is a beautiful ecosystem. It is not a machine like some Lexus commercials from Christmas a few years ago would have you know, right? We are not machines. We are whole ecosystems, and we are plugged into a greater ecosystem. And it's in working with those rhythms and understanding the things that our ancestors knew, things that our grandmothers knew, and really taking that power back. And for me, I love all the innovation and the technology. I love how far medicine has come. I love how far biohacking has come, and how, there are things for thousands and thousands of dollars that you can go do to help with the aging process and prosperity in your body and thriving and living really full lives. But I'm all about what's accessible to every individual, whether you live in a hut, thousands of miles from civilization with no internet access. And if you're someone with a 5-car garage and a really, really comfortable life, what can we all do? What's accessible to all of us? So that's my life's mission. And now I'm focusing a little bit more these days on whole person coaching. So coaching, especially inner mastery of emotions, of standing in responsibility with your own self, of navigating relationships and communication, setting boundaries, because it's all interwoven. It all matters, and it all affects our well-being. It affects dis-ease, because that's what it is. It's a lack of ease. And it goes both ways. So that's the long answer.
I love it. Thank you for sharing that. And so what other influences have you had on wellness, autonomy, and sovereignty?
Yeah, so more recently, in the last several years, I've started working with plant medicines. A lot of the things that the psychiatric communities have now been doing great research with for people with PTSD, deep depression, suicidality. It's amazing, addiction. And so again, that's the environment I came from, working in a clinical psychiatric setting where we were dealing with those kinds of things. And now seeing it from a different vantage point, where it's more connected to nature and more guided in a space of, you're in charge of you, and what life do you want, and what kinds of things do you need to face and acknowledge, and how are you relating to nature and your own nature. And so I now live in Costa Rica because there are a lot of opportunities to work with these plant teachers, frankly, is what I consider them to be, and what many people who work within these circles consider them to be, because they are living beings, and all living beings have a DNA spirit imprint, right? So every substance, even an apple, has its own energetics. And when we take it into our body, it becomes part of us. And we all have the ability to have broader consciousness and become more deeply aware of what's really going on when we're not in distraction or in problem solving or in to-do lists. So I've been working more in the space of mindfulness and finding autonomy from the place of every single day of our lives being that day of our life, right? What are we doing with our life today? It matters how we choose to come to each moment. And some of the people that I look up to and consider mentors in this space would say, like, this is the ceremony of your life, right? Like, we're so used to funerals or weddings or bar mitzvahs or confirmations, or we need a ceremony for something to be important. And I think that if we approach our life from this like sacred place, from this place that like, this freaking matters, all of it. And if we're feeling like a victim, or if we're feeling like something's out of balance, if we're feeling there's a conversation that needs to happen, if we're feeling like we've given ourselves away or we're a perfectionist, that's going to impact our well-being. So can we get a little under the hood, so to speak, and look at what's really going on and say, well, what would shift that for me? What support do I need? What resources do I have? What resources and support might I need to seek out? And what's in my power right now? So that's a little bit more where the influence is. It's a really beautiful thing, and I think you might also resonate with this. I feel like, especially in a culture where I grew up, all of my adult role models, for the most part, were employees. I didn't grow up around a lot of entrepreneurs or people who were living life on their own terms. And now I work for myself, and I'm doing it mostly from a computer. And it's really interesting, the bittersweetness of that from day to day, because it's something that I'm fully responsible for my own well-being and my own life. But I also have to trust that there's a bigger power. There's something bigger that's really always supporting me. It also means, though, that I can't outsource my responsibility. I can't outsource to someone like a bad boss. Like, I've had bad bosses in the past. I can't outsource how miserable I am to my boss anymore. I can't outsource my bad days to, oh, that client was just so difficult. Like, I have to take full responsibility for, are you setting the parameters? Are you having the difficult conversations? Are you walking away from things that are not healthy for you? Are you giving yourself, compassion and forgiveness when you do falter? And so it's really up to me to live what I'm teaching. And I think that that's also the thing. So many of us have values that we really feel strongly about. And then a lot of times we betray those values to ourselves and then expect that we're going to be well, that that we won't have something out of balance in our bodies or our hearts or our minds, or the external representation of wellness.
Mm-hmm. That's a really good point. And I see how that applies in healthcare as well, that we've outsourced our health and our care to other people.
Mm-hmm. Yeah, it's interesting too, because there's this dynamic in the world right now. We're all going through a really intense time, probably the most intense time any of us have ever experienced in this lifetime, in this generation. And on the one hand, it can be fortifying. It can be a call to presence. It can be a call into our own highest good and value. On the other hand, there's also so much misinformation in every direction. There's a difficulty in really, really knowing what is absolutely true. And this outsourcing of our power and our control is shown in the political spectrum of how it's affecting, people disagreeing with each other, and emotional violence, basically. A lot of emotional violence is what I'm witnessing. A lot of people, because everyone is ideally desiring to do the most loving thing. And often what we're seeing is people acting from fear,
mm-hmm.
right? So fear says something bad could happen. I could die. But our bodies are designed for that environment. That's always been the truth. It's been true, in 2019, it was true. The only difference is that now we're focusing on the one big factor that's affecting all of us. And so it's really a call to action in self to be able to acknowledge, am I choosing for me the absolute best habits, behaviors, practices outside of what medicine can do for me? Because if all of the fear mongering is correct, then this whole thing is going to destroy all of us. That's what's happening, right? Be afraid because it's coming for you. But last I checked, that's true of me doing anything, right? Like
Getting in a car and driving.
I've been in a number of car accidents in this life. And my insurance policy with the car was a third-party entity whose job it is to clean up the mess afterwards. The challenge is we have chosen for that to be the medical community and or the government or entities outside of ourselves. And the question that really a lot of people are unwilling to answer is, have I today made every possible decision for my well-being that will fortify me to be the one to decide, how I'm going to feel today? And, you know, we can get into so many different directions on this, but placebo and nocebo are very, very powerful things, right? So the majority of effectiveness of pharmaceutical substances is attributable to the placebo effect. We trust that it's going to work for us. We trust the antibiotic is going to kick the bacteria, the one that we want out. We trust that the blood pressure medication is going to help our heart re-regulate so that we then don't have to live in a fear of our heart exploding. We trust that the people who prescribe these things for us want what's best for us. And that's beautiful. Unfortunately, a lot of those things, it's been a slippery slope to profiteering. And when I look back on when I was a child, the family care doctor that we went to was very conservative in his approaches. He was very, very slow to prescribe. I wonder about that these days. I don't know. I don't have children, so I'm not bringing a child to a pediatrician. And, you know, you think back, I recently was rewatching some episodes of Downton Abbey. And it was really beautiful because when the doctor would come a-calling, he knew the whole family. He knew everything that was going on. He knew what was stress. He knew and could say, you know, do this thing with your diet, do this thing with rest. The doctor of today doesn't even have the power to speak to someone in that way because they are paying off hundreds of thousands of dollars worth of student loans. That's way faster and easier to pay off if you don't get sued and lose your license. So there's fear throughout the whole thing. There's a lot of upholding, like, I gotta just make sure this person doesn't get worse. That's my job. I can't let them get worse because the hospitals can't handle it. And I can't handle the repercussions of it. And it's really like putting a Band-Aid on a gas leak, right? And then so we look at placebo in a different way, right? What a lot of the people right now in this controversial time who are railing against being expected to get a vaccine just because a good portion of the population believes it's the right choice because the numbers that they're seeing show it to be so. The thing is, those people trust their bodies and trust their immune systems. And we've created a landscape where we're so in distrust of our body being able to be ill and bounce back that it's contributing. It's contributing to more fear and anger because now there's a whole host of people who think that someone who trusts their immune system is putting them at risk. Instead of saying, why don't I trust my immune system? How did I get here? How did I get to a point where I don't trust the thing that is the only thing that we know to be true? Because the science could flip-flop tomorrow. We know that. That's happened multiple times in just a decade. The things that we thought were right for us because science said, here's conclusive evidence. Even a year later, 5 years later, here's some conclusive evidence to the contrary. But we know what a tornado does. That's not different. There's no changing the prediction on that. And we know how bodies take in foreign things. And we know how bodies that are healthy and in full balance deal with those foreign things. In fact, breast implants, I've had the beauty of getting to do a cadaver dissection a number of years ago. And I was able to see how the body encapsulates things like joint replacements. Our body is designed to keep things that are not belong there out. I know a lot of massage therapists who have massaged women with breast implants, and they say they always have to break up the scar tissue that protects their body from the implant. So we are designed for this. It is perfect, more perfect than anything that comes out of an Amazon warehouse. More perfect than that Lexus I mentioned earlier. So, yeah.
So did you decide on Costa Rica as the place that you would land because it's a blue zone?
No, I think so. I believe in the unseen. I believe in this idea that there's a higher power version of us. So anytime we've had our deeper intuition tell us yes or no about something, and we did it anyway, it's almost like there's two versions of us. There's like the Wizard of Oz, like hanging out behind the curtain. And then there's what you see on the outside of the curtain. And so the person who's living our everyday life is what's in front of the curtain. But the Wizard of Oz is our deeper knowing and the parts of us that are always wanting to move toward what's really going to fulfill us, even if it feels uncomfortable or it seems like a really big hurdle to jump over. So Costa Rica kind of happened by accident. I started traveling in 2015 and fell in love with this place, and then started falling in love with how potent the relationship to nature is. And it's not necessarily an easy place to live. So it's beautiful, it's powerful. And there are a lot of like-minded people here who want to live closer to nature and live more simply. For example, I referenced Amazon earlier. You know, when I was in the United States, if I wanted something, I could order it right now. And now I have to really wait and decide. It's going to cost more. It's going to take more time. And there's a different kind of benefit to that. But I do feel that my subconscious did bring me here because of all the factors that the Blue Zones talk about. So for anybody who's watching, the Blue Zones is a really, very popular book that talks about, this exact topic, right? The myths of aging, but essentially from a different angle. It's looking at what's not a myth, what we know to be true. We know that there are certain things that influence living to 100 years or more, right? Without crazy technology, without biohacking, without all the amazing stuff that's in the world right now, making the possibility of living to 200 and going to space without having to be an employee at NASA possible. But outside of that, there have been people living long lives, healthy long lives, actually very fit long lives, very strong and agile and able long lives. And those factors have nothing to do with technology and pharmaceuticals. They have to do with food. They have to do with mental space and mental health. They have to do with relationships, nature, knowing that there's something bigger than us out there that's kind of worth trusting and surrendering to on some ultimate level. I know there are more factors. It's been a while since I read the book, but there are things that are pretty universal and accessible to all of us. And that when you look at, all of these things that have come out in the last, the internet's so great because you can get exposed to so many things. But you've probably seen, and anybody who views this has probably seen, like if you interview people on their deathbed, what they regret. Usually they're not going to regret more doctor visits or less doctor visits, right? They're not going to regret going and having experiences and doing things that might be challenging, but climbing to the top of a mountain and seeing a beautiful view. Usually what they're talking about are these things like, I regret that I didn't have a better relationship with this person in my life. I regret that I didn't say thank you more. I regret that, I didn't do that thing that I was dreaming of doing. And I thought that life had to be about work. So it's these factors. It's the same factors that we're going to regret on our deathbed that are the myths of aging and illness. Basically, like, it's super simple stuff. It's actually laughably simple when you get down to it. Which means it's awesome because it's accessible.
Mhm.
It's really liberating. Puppies are a good thing.
They are. There is a doctor, I cannot remember her name, but she wrote The Heart Speaks. She was a cardiologist, and she recognized the benefit of animals on people's mood and health. And she started writing prescriptions for dogs, like on a prescription pad, go get a dog.
Yeah. Yeah. And it's crazy. It's so interesting. I actually dated a doctor a number of years ago who had a chronic inflammatory illness. And he was seeing one of the best GI doctors in the country to help him. And I said to him, okay, so he gave you this list of things to eat when you're having a flare. So it was ulcerative colitis, right? Which is a pretty intense and very uncomfortable experience. And it can lead to colon cancer, and even the medications that are prescribed to try to keep it at bay, they increase your risk of colon cancer. So it's really this interesting snake eating its own tail. But I inquired with him, okay, so this amazing doctor that you're seeing, is he telling you anything that you should or shouldn't eat to prevent the inflammation in the first place? And he said, no, I don't know. I'll ask. And the guy said, no, there's nothing you can do. Now, I'm not saying that that's the standard of care. It's just the experience that I witnessed, right? It's just anecdotal evidence.
It's very common, though. It's very, very common for patients to hear there is no relationship between what you eat and how you feel.
And we know that's not true, because you eat a Big Mac, you feel like heavy sludge. You eat an apple, you feel very different. And in fact, this is one of the ways that people can take power back, is things like journaling and just jotting down and paying attention to their moods and energy levels around mealtime. And then it's also how you eat, right? We all know someone who is anal retentive or OCD, not diagnosed, but we all know someone in our lives, it could even be one of us. We all know someone who's anxious and nervous and trying to get everything done, and maybe trying to escape some deeper emotions. And so they're the person who doesn't sit and chew their food, and they don't sit quietly at a meal, or they watch the news and murders happening. There are things that influence how we even digest our food that have nothing to do with symptoms, that influence how we feel and influence how we live. And so, but I wanted to emphasize a kind of contrast to that other story about this ex-boyfriend of mine, who's happily married with 2 children now. Awesome. But I remember at the time, I would try to share with him what I was doing and what I understood, because I was vegan at the time and I had been studying, nutrition stuff for a while. I also have Cornell has a really great e-learning platform, and they have a certificate program in plant-based nutrition. And it's really great to see how literally to have, what you said, certain physicians will say, oh, it won't do anything, it has no effect. And then to have this person who used to work for a dairy farm do a complete 180. And they showed evidence of how when you eat leafy greens like kale, there is an in the moment, real time enzymatic release that repairs part of the damage to the walls of your arteries that happens just through living. Tell me food isn't involved when that is built into the system. There's no college to go to make that happen. So it was really interesting and compelling to me that after this boyfriend and I broke up a number of years ago now, he eventually went to go see a functional medicine doctor. And then we linked up at some point, socially, to connect once again. And he said, she's had me doing everything you always did. And it was like, yeah, a different perspective sometimes is all you need. And most medical professionals, again, I can't speak for how it is now, but I think the average amount of nutrition education they even get. So food becomes us. Food is our way of actually living. But they only get, I think it's 1 week's worth of nutrition in 4 years of med school, a year of residency, and maybe another year of fellowship or beyond. So in all of this education, it's pretty limited. And that is actually something that's symbiotic with the body. So on the flip side, I remember a plant-based nutritionist who I met at a fitness conference who showed some research experiment that they did where they took inner city people who were low socioeconomic status, and they brought in like a food pantry on $4 a day. They had these people eating vegan. I'm not saying people need to eat vegan, but that was the point of this. So they were eating highly nutritious food. And a lot of these people were able to turn around effects from their health, and their medications were able to be lowered in their dosage. At the very least, if we're not going to get people off medication, can we lower the dosage? Can we do less work for the liver? Because that's actually one of the organs of longevity that's affected by constant chronic pharmaceutical use. So like, it's just about looking at it from this perspective of like, this don't make sense. It doesn't make sense.
I heard the functional medicine pharmacist and nutritionist, Lara Zakaria, had the best explanation for sharing with patients on this very topic. And she said, patients often have a hard time remembering to take medication. They just can't remember to do it. But what do you do 4, 5, and sometimes 6 times a day without fail?
You're gonna eat. Yeah.
Let food be your medicine, because you're not going to forget to eat.
Yes. Yes. And there was a time before pharmaceuticals. And yeah, again, there are certain aspects of medicine and the pharmaceutical industry that have really saved us in certain ways. We have a population that wouldn't exist. A whole host of people in our population wouldn't exist if we didn't have these innovations. But there's also, it's so interesting to me because I've also worked with fasting, right? I know that that's like a big deal. And that's something that's super powerful for epilepsy and diabetes, just to even manipulate when we eat, not just what we eat, but the timing of it is super powerful. And last I checked, there are a number of pharmaceuticals, a good amount, that you must take some food or drink with. So for them to even work well and not cause our body more challenge, we need nature in the situation, right? It's kind of funny how it just keeps knocking at the door. Yeah. So it's compelling to me. And then the other reason that you and I have this unique connection is pain, chronic pain.
Yes.
Right? Food can either feed inflammation, depending on what you choose to eat, or starve inflammation and restore the body. And so, chronic pain, we also have a pharmaceutical abuse, and an addiction issue. And so these ways of coming to dealing with chronic pain, which a lot of chronic pain in some of the clients that I've worked with in just the last year are actually emotional trauma that's been unaddressed. So, we keep throwing a pill at something. Okay, maybe it'll work, but what else are we doing? This is where I do respect psychiatry as a field, because the rule for most psychiatrists is they won't prescribe without also prescribing therapy, where you actually have to go and be part of the process. You have to put yourself in vulnerability and in being seen and in acknowledging and seeing yourself, versus, people forget to take pills and, birth control, for example. There's so much not shared about how birth control affects a woman's well-being. And we can be in symbiosis with our cycles and with nature. And that's one where if you don't take that pill, you might end up with a bigger situation than you're ready for. In a world of overpopulation and hunger and pharmaceutical, the pain medications becoming addictive. And so there's so much that just goes into this concept of, if you love your fellow man or woman, if you want to be a good neighbor, take great care of yourself and do it in the ways that you don't even need to leave your house to do it. Do it in the ways where you don't need to go to the pharmacy to get the thing. But it really is powerful when you recognize that there are dollar signs over all of our heads. I'd rather give my money to the farmer than the pharmaceutical reps. Because every pharmaceutical rep I knew had really nice nails and really nice cars and really nice cell phones. But all the farmers I knew had really happy families and knew me and, you know, are touching the food that's going to become me.
Can you speak a little bit more about the relationship of fascia to chronic pain and our movement in general? I'm a big fan of using movement as medicine. I'm always recommending for my patients to find some sort of movement practice. I try to avoid calling it exercise, since that tends to have a negative connotation. But I would just love to hear your take on fascia.
Yeah, it's interesting because I too have kind of thrown out the word exercise. As a fitness professional, I think it's a dumb word these days because it has attached to it that it's something I do for a finite amount of time because I have to or I should. Whereas we evolved to move. We literally have the bodies that we have the way we have them based on our movement, our visual system, and our hands, our ability to grip things, hold things, and have dexterity and communicate with our hands, and our feet are all designed to traverse an environment that we in modern living have actually made obsolete, right? We don't need to get up and move to function in everyday society anymore. But the challenge is our bodies never changed. And there's a really great book by Dr. Daniel Lieberman called The Story of the Human Body, Evolution, Health, Disease. I know when I read the book, it had a big footprint on the book jacket. And it was really interesting because he goes into even the changes in our skulls and how our most direct ancestors. So Australopithecus comes up a lot in that book, that term. So essentially before Homo sapiens, before Homo habilis was Australopithecus. And we were chewing 15 hours a day on average. So the average hunter-gatherer today, who I'm pretty sure moves via walking for the most part, and maybe some hunting and gathering, about the equivalent of about 20,000 steps a day. And here's the other thing that's compelling. It is our society and how we've decided to make our minds the only thing that matters and the battery that's keeping everything running, like the Matrix. It sounds so dystopian, but it's real and it's happening. But basically, if you look at the average baby, the average toddler, they do a marathon a day, just in functioning. That changes when we sit them at a desk. That's the only reason it changes. We tell them to sit down and stop moving. And then we diagnose them with ADD and prescribe a medication. So our connective tissue, if we look at the embryonic stages, when we are developing in the womb, initially, we're just this mass of cells that starts to, get bigger and bigger and bigger and expand. Eventually, once it starts to really take form, so these beautiful sonogram pictures. I have a few friends who just had babies and who are pregnant, and these pictures are even more so realistic, like so detailed. But before that happens, we are basically what becomes our connective tissue and the DNA. The connective tissue and the DNA have a conversation, and that conversation is what decides what's going to become an elbow, what's going to become an eyeball, what's going to become a liver. So your connective tissue, the DNA, and then eventually, the cord, the dura cord that becomes your spinal cord and your peripheral nervous system, that becomes who you are. That becomes the deepest, oldest memory of you in this body. It is designed to be fluid. When we're in the womb, we are floating in fluid. It's a tight space, but there's constant motion. There's a tiny bit of constant motion. When we come out, right? Why do we swaddle babies? Because they want that tightness, because now the constant motion is happening more internally, right? Now it's the metabolism. It's the taking the breast milk, making something with it, and growing rapidly. The growing isn't quite as rapid in the womb because there's only so much room. There's only so much space to spread out. You don't want too much rapid growth beyond a certain point. And so what happens is, me as a fitness professional, I used to get it a little bit off too. I used to focus on the muscles and the bones. The muscles are what create force. The bones are what are moved. But what actually moves us is the fascia. It is the connective tissue. My favorite random stat to this day that will always stay with me, it's one of the ones that Sue Hitzman, who created the MELT method, anyone who's watching this, MELT is for you. MELT will help you with any pain or what we call pre-pain signals. So I swear by it for my body. I do crazy things. I've been in car accidents. I have a funky hip thing from a car accident from years ago. This is my insurance policy. So the beauty is, she shared that if I ask you, let's make this interactive. If I ask you to put your arm up over your head, go ahead and put your arm up over your head. And anyone watching, put your arms up over your head, right? Now put them back down. So what happens in the body is your brain gets the words coming through, sends it at some point in that whole process to your motor neurons, or the nerves that control your muscles. That rate of travel from the brain receiving the information and going, okay, muscles, okay, deltoid, okay, bicep, okay, latissimus dorsi, you relax, you work, go. That travels at a rate of about 150 miles per hour. It's like a really fast sports car on a racetrack, okay? That same signal goes from your brain to every portion of your connective tissue, because your connective tissue is this structure and system, this webbing and this fluid and this filamentous, really beautifully textured, like Google it, look it up. It's amazing. Dr. Jean-Claude Guimberteau, I know it's been leaked on YouTube. It's technically not supposed to be there, but there are clips of some of his videos of in vivo live footage in a living body. This is also part of the problem. So much of science up until the last 10, 20 years wasn't looking at this system. They thought it was just inert packing material. It was just, the stuff in your junk closet that you have to sift through to get to the thing you're looking for. So that same signal goes to every part of your connective tissue at a rate of about 750 miles per hour. So all of the connective tissue throughout your whole body, and especially the connective tissue around your shoulders and your neck and your skull, your lung tissue and your heart, got the message and said to the muscles, before the muscles even got the message, sure, I will let you do that. Go ahead. And morphed and adapted so that the muscle could do its job. So this concept in movement and fitness that we need to strengthen our muscles or build them, that's fine if that's something you want to do, if you feel like you're losing muscle, or that that's going to fortify your wellness. But it's really moving more in any way. Even that, it's not about push-ups. It's not about running. It's not about calories. It's not even about, did I push my heart rate high enough? That's important, especially if you are out of balance. It's important to push the system, because that's how we create resilience. The same thing as our immune system. We need to have germs. We need to have invaders for the parts of our body that are fortified and strong to get fortified and stronger. If we don't let the invaders in and have a strong body to build on through things like movement, through tearing the muscle fibers, through going for a brisk walk or an uphill walk or running, if we don't have those micro tears in the vessels of the heart lining, then the body can't fill that back in with stronger, better, more resilient tissue. And so it's just breaking down. And that's what we know about cells in any living being. If we create the conditions for stagnancy, if we don't move or don't challenge sufficiently, the system starts to break down. We start to kill more things off than we build up. The same is true if we overdo it. So it's not about being an athlete, right? We love watching the Olympics, and that's amazing. We don't have to push that hard. It's about getting up. Look at your dogs, look at your children, look at your pets. They're always moving a little bit, right? Even cats that are sleeping all day, they turn over again, they stretch, movement is how we were built. And this is the other reason to move. It makes us smarter. It makes us more resilient, more agile in our brain tissue. It makes us have more problem-solving, creative thoughts. And in fact, getting up and moving is so important because our visual system was designed along with the environment to track predators or prey, or to figure out where the food was. We don't do that anymore. We stare straight ahead at a lot of screens, windshields, and maybe a friend across a table. We don't look in our environment around anymore. And so we don't actually even know what's going on. So you can actually use your eyes to stretch your neck, to stretch your spine, to stretch your hips. And there, I just also created new neural pathways for knowing my environment, knowing what I can and can't trust that is and is not safe. And I can guarantee you, if I did that a few more times over the course of 5 minutes, later on, I'm going to have an epiphany for that project at work if I'm in corporate America. Later on, I'm going to figure out, oh, that's why Timmy is acting up. I completely forgot, this thing that I promised we would do, and he keeps asking about it. Like, it really just creates those connections for the whole thing to come together. So that's a simple answer.
I love it. It's so good. We have to move. I'm always in awe of my children, watching how they just squat effortlessly and how we lose that. And then the studies that show that when we lose our ability to squat, or we lose our ability to get up and down from the floor with ease, that it impacts our longevity. And I've made it a goal for myself to get that back, because I know that it's not a normal part of aging to lose your flexibility. We've been told that, and many of us just accept it like, oh, I'm getting older, I'm going to be stiff and lose my range of motion. And it's not true, but we have to move to maintain our range of motion. And we may have to do a little bit more work to get back some of the range of motion that we've lost.
Yeah. And it's super simple. So I was working with a client this morning, a personal training client that I still work with now online. We used to work live in his home in the States. And he's 79. And we were doing a move that is essentially with that goal in mind, right? Getting up and down off the ground from a kneeling position. So like a split kneel where one front foot is on the floor and the back knee is on the floor, and then getting up from that position. We've been working that move for the better part of the last year. And I was really, really stressing doing it with him almost every session for a good 4 or 5 months. He got really good at it. And then I backed off. I didn't push him so much at it. He wasn't doing it without me. When I reintroduced it, he couldn't do it. It's that simple. And then today, the really beautiful thing was he did it. He chose to focus on how many he did. I was able to frame for him, like, did you notice you focused on how many you did and not how hard it was, and not that you think you're not good at it? And I said, you know what that means? You did 5. That's our benchmark. And he goes, oh, great. That means you're going to make me do a lot more. I said, no. How many more do you think I'm going to make you do? And he said, 10. I said, no, I just want you to do 5 or more. Right now that you got it, keep it. But it's also beautiful at 79 that this person could gain flexibility and power from the ground and lose it, which shows us that it's not as hard as we think, and it's not gone. When we don't think we have it, it's not gone. It's super simple. We all have doors with hinges. I know these, you have these barn doors that everybody loves so much. I know they've been so popularized. But if we think of an old school hinge door, if I only ever cracked the door for a few years, and then I tried to open that door all the way, what's going to happen?
It's going to be hard to open.
It's going to be a little rusty and squeaky, and I might actually crack something, right? That's what I think everyone's thinking. If I try to go to that range of motion because I don't have it, I'm going to hurt myself, right? It's so important for us to keep the context of don't expect yourself to be the best at it, but also don't expect to have the benefit of it without working on it, without attempting it, without making a little bit of effort. And there's a really great woman. Why am I drawing a blank on her name? On Instagram, and I think her website, she goes by Nutritious Movement. I'm going to look it up so I can.
Name. What a cool name.
Yeah. And so I heard a podcast with her years ago. She's got multiple books out. She talks about this, and she creates novel movement environments in her home. And one of the things she was talking about on this podcast I first heard her interviewed on was how, again, this eating thing. On average, we're going to eat like 3 times a day. So instead of putting the plates in a high cabinet, she chose to start putting the plates in a very low cabinet that she needed to squat down to get to. So that at least 3 times a day, she was squatting, and it wasn't exercise. It was, I'm going to do this essential movement, and I'm going to make it foolproof. I'm going to make it a necessity. I'm going to make it something that I can't get out of doing. Now, she's also gone as far as creating like jungle gyms in the house for her kids to like climb the walls. They don't have beds. They have movement space, and they basically put down a very thin mattress and a sheepskin cloth and then pick it up every day. But you see, in that context, they're getting movement just to get to bed and just to start the day. So what we need to get back to is not, oh, I need to move more. It's going to be hard because I don't move a lot. It's where can you make it so laughably easy and create it as a component of how you live your life. One of my favorite statistics back in the day when I would go to all these fitness conferences, because I was a geek. I loved the info. I loved the science. I loved the outcomes and having something to illustrate for people, right? Because it helps. It helps when we have a reason why it's true. Right? Whether or not it's always true. For some reason, we need a reason to know it's true, to really believe it sometimes. And so they had done research on people who were either always at a fairly healthy weight and people who had lost a lot of weight and were keeping it off. Because, a lot of people lose weight and then gain it back. And the number one factor was not their exercise. It wasn't their workout for 30 minutes or an hour a day. And many of these people were doing that. It wasn't that. It wasn't accounting for enough. It was what they called NEAT, N-E-A-T, non-exercise activity thermogenesis. What this is doing your own chores in your house, mowing your own lawn, folding your laundry, putting it away. It was activities of living and moving. And basically what the people who kept the weight off all had in common was they didn't have a cleaning lady. They didn't have a gardener. They just took care of their own life through movement, or they took care of their movement through taking care of their own life. So it's not necessarily saying that if you have a cleaning lady or you have a gardener that you're doomed, but there are ways that are super simple that actually might save us money in the long run. And really that's, I think, the major thing. So many things for so many people come down to money. And the number one thing I think that affects aging negatively is a fear of, will I run out of money? Will I outlive my money? And so then there's a subconscious desire not to get too healthy, perhaps. But the things that keep us healthy also keep our costs of living down. And so there's a higher likelihood that if you're able to take care of yourself till the end of your days, you won't need funds for a nursing home or care. And isn't that what we really want? It's not even a question of how long the life is. It's the quality of the life. We want to get to those last days and say, I feel good and I'm not a burden on anyone and I'm not depressed and I'm not anxious and I'm not sick. We want to say, I was able to play with my grandkids and run around in the backyard with them. And then I felt my heart tell me, I think it's the end. Isn't that ultimately what we want? And aren't we all worthy of that?
You just described my grandmother's story. She was healthy, lived to 91, and then was having some chest pain, went to the emergency room, and they told her, "You're having a heart attack. You need to go to the cath lab." And she said, "No, call hospice and send me home." And we had 2 more good weeks with her, and it was such a beautiful experience
Mhm.
to go home and share stories and laughter instead of her being in a hospital bed with an unknown amount of recovery time, or even her not making it off the table. And I think she gave us a wonderful gift for going, "Okay, it's time."
Yeah. I read a few years ago something, I don't remember where I read it. I don't remember the specifics of it, but it basically was saying the end of life, the way that we treat people, the way we care for people, the way that we keep, sort of disease management at the forefront of care, rather than quality of existence. What
Mhm.
you just described is how we're all supposed to go. That's how nature does it. Nature slows you down so much that you eventually just take your seat and say, I'm gonna move out gracefully. And so yeah, it might be an illness or something, but about 2 weeks on average is what a healthy death looks like. And I think that's maybe a term I've never heard before, but what does healthy death look like? We don't actually, in America, I don't think people know what a healthy death, the majority of people, I don't think they put those two things together. Now, what most people want to avoid is this lingering and management of care and dignity taken away, and tubes and bells and noises and staff being changed over. And so whatever it was that I read basically said that most high level physicians would not let themselves be put through that. But we think that that's an okay standard of care for some reason, right? We allow for that. That's why this conversation is so important, because we really have to ask ourselves, do I want the story that Veronica just told? Do I want the story of someone who said, no, thank you, and got to go with dignity and grace and be in a place where they left a gift to their family members? As opposed to, now, especially anyone who's going, a lot of the people who are going, who have a lot of challenging health concerns pre-corona, their family can't even be with them. And who knows what that experience is like for the person who's passing. Who knows how uncomfortable whatever devices and the standard of care for legal purposes that the nurses or the doctors have to poke and prod. They have to check this thing or that thing because it would be illegal. It would be wrong for them not to. But there's a different way, and it's possible. And it does require everyone really. I said this to my mother a number of years ago around something completely unrelated, but it was one of those profound things when you say it, you go, I'm going to keep this one. I'm going to remember this one. We have to let our courage be 1% more important than our fear. We have to let our courage and our belief in a quality of life that's available to us be 1% more important than it's hard. We have to let that true courage, and the root of courage in the French and the Latin is from the heart. So we have to let our vulnerability speak for us, not to keep us held in a corner and beholden to something that is easier, right? Like a pill or an injection or surgery. On the one hand, it's easier, right? It's one fell swoop. You cut a thing out, or you implant a thing, or you take the medicine, or you, whatever it is. It seems easier because it's less involved in the long term. But I don't know about you. I'm going to use the analogy of sex. If the goal of sex was just to get it over with, sex would be no fun. If the goal of our care, of our health, is just to get it over with, life's no fun. I want to have a life full of fun. I want everyone who you touch and everyone who I touch and everyone who sees this conversation to have fun, to live a full life filled with laughter and play and tears and anger and all the things that, one of the things that set me on this path is I have a mother who deals with some mental health issues, and she's been on psychiatric, depression medication for pretty much most of my life. And there's just something missing sometimes in her. And I want more for everyone. I want everyone to be their full selves, be fully alive.
I had a patient once describe to me that taking antidepressant medication for her was allowing her to accept the things that should not be acceptable. And it wasn't until she was able to work through several things and come off of those medications that she was able to make the decisions to cut certain people out of her life and no longer accept these terrible conditions that she was in. And the medication made it possible for her to accept what was unacceptable.
Yeah. And pain, right? Emotional pain, right? What you're describing is more emotional pain, but physical pain, there's a lot that goes into how the body tricks us into becoming slaves to our pain. The body has its ways of wanting to keep us in a holding pattern. And it's why we need to look at all these other factors, right? Like I said, the body's an ecosystem, and it's a beautiful thing to trust, but it's also kind of like a lazy teenager. It doesn't like change as much until it's already happening, until it's in adaptive mode. And so physical pain often is a messenger for emotional pain, unresolved trauma, heartbreak, grief. These are also the things in the fabric of our society that medicine, pharmaceuticals, the political structure, all the systems that supposedly are there to take care of us, it's very inconvenient if we're in those processes, if we're acknowledging our heartbreak and working through it and allowing ourselves to have, a roller coaster of emotions and getting until we get to the horizon and the sunrise again. It's not convenient for us to grieve loss. And that's what we're doing right now. We are in a worldwide collective grief right now. But we also have been taught that grief is not welcome here. There's no time for that. Let's get back to normal. Let's get past this. How about let's acknowledge there are many, many, many living beings in this world, human and other. We are all worthy of beautiful lives. Many of us are hurting. Many of us are struggling to figure out how to get to the life that we know is available deep down. And so it's so important to recognize that if we don't acknowledge pain as a messenger, and pain medication shuts down the messaging system, right? I can't remember the name of the disorder, but there is a disorder where some people can be born where they don't feel any pain. It's quite dangerous. So eliminating pain is not the answer to making pain better. It's asking pain what it has to tell us. It's asking ourselves what is upholding pain as this loudspeaker that's yelling at me because some whisper somewhere else I didn't have the capacity to listen to. And what do I need to shift or change or acknowledge or allow to make space at the table for the messenger to speak? How will I listen?
Man, and being heard offers so much healing. In many cases, depending on the circumstances, it's often enough to be heard, even if there's no resolution. To be heard is very soothing, very healing.
So I would invite you and everyone, myself, to imagine the Buddhist path of meditation uses this as a really, really good option, right? And this is what I love about what I've cultivated in how I show up and all the different things that I bring to this conversation and to my coaching and to my movement coaching and all the things that I offer folks. It's a beautiful patina. And we all have this, right? I'm not an expert. I just know some stuff. But the path of suffering in Buddhism, in certain branches of Buddhism, they call suffering, right? The energy of suffering, the experience of suffering, Mara, M-A-R-A. And you can think of it almost like one of these pagan gods showing up at your doorstep and banging on the door. And so often what we want to do is we want to shut Mara in a closet. We want to make Mara go away. Oh, no, Mara. But what would happen? Tara Brach, who's a meditation teacher, and I think she's also a psychologist or has like a background in psychology. She's beautiful. She's a wonderful approach to these kinds of things. And she says when we sit in mindfulness or meditation or just compassion, we invite Mara to the table, just like a friend that we're trying to say, like, you know, you did something really erratic back there. Do you want to talk about it? We need to get to know our Mara. We need to sit down. And so this idea of listening, it's actually so funny because this is something that I'm working on right now. I'm actually offering a class next week. So I wanted to say to you and any of your people, I would love for them to come and attend. And what I'm doing now is actually offering two for almost one price. So it's 45 for one person or 55 if two people enroll. If three people enroll, whoever referred the other two will get the class for free. So you guys can like then split that amongst yourselves, because it's all about furthering this specific topic, which is, are we listening? Are we really listening? And like you said, sometimes just being heard, even if it doesn't resolve, can be enough. But where does making the space for another to be heard start? Are we listening to ourselves? Are we really hearing ourselves? Because I can probably safely say with the right amount of prediction that the majority of people who are on any kind of pill or, you know, who are looking toward this outsourcing of care to be better, to get better, to manage their health, they don't want to be. I think really deep down, if we polled every single person who has to take medication on a more than acute basis, they would say, I don't want to do this. I don't want to need this. But are they listening to that voice? And are they then finding people like yourself, people like myself, people like Jenna? Are they exposed? And this conversation, I think, is another way to just put that into the world. And remember that these conversations matter. And listening to ourself is the beginning of the conversation.
That was so good. So full.
I didn't know what we were getting into today. I just figured we'd go with it.
It was wonderful. And to end it on listening to yourself,
Mm-hmm.
because that's really where it's at in moving forward and aging more healthfully, is listening to our bodies and reestablishing that mind-body connection, because our bodies are so intelligent.
Mm-hmm.
And there's so much good information that we can get to guide the health journey if we'll take the time to listen. And you're right, a lot of people don't know. And so to share the stories, for people to know that they have other options and that there are other ways of caring for our body and other ways of being in the world.
Yeah. A resource that I would love to share that already has been like a freaking avalanche of amazing in and of itself. Like it doesn't even need me to promote it. But there is a psychologist who used to be out of Philadelphia, then moved to California, and now I think she's in Texas. And I imagine part of that is actually because of what's going on in the country right now, that there are certain pockets of the United States where people can really send this message of, you are the only one who's responsible for your best life. The government is not, the medical community is not, getting a vaccine won't do it, getting the virus and dying ain't gonna do it. Like it doesn't matter, right? All of this external stuff is external stuff. But she was a more classically trained psychologist, and her program wouldn't even let her explore things like mindfulness, but she was starting to do these things for herself and started shifting deeply seated family dynamics in herself and seeing her own shadow and seeing where she needed to shift and change. And part of it was in moving and eating better and cleaning up her gut. And so she came out with a book this year called How to Do the Work. And she's self-published. She goes by the holistic psychologist on Instagram, and I think even her website. She's Dr. Nicole LaPera. And this is a perspective that anyone can jump on today, right? This is a framework. And in fact, like some of the coaching I do, as I listened to her book on audio, and I even gifted it to my mother. It's something that it's a really straightforward approach, but it's tough love. This work of really listening to ourselves and getting real with the pain, with the emotions, with, this woman that you shared about, there was some stuff I wasn't willing to process and acknowledge. Well, life's too short, or life can be shortened, and it's not worth it to let things fester and show up in your body and then get a prescription for whatever's showing up in your body, because that's how it works. Outside of the acute germs and the crazy things like, a broken leg or something, congenital, outside of those things, it's being in terrible relationships and not being willing to have difficult conversations and or walk away. It's limiting ourselves and shrinking ourselves, or stepping on others and not really acknowledging, what, I do that, I bulldoze, I need to look at my stuff. It's that stuff that eventually becomes heart disease, that eventually becomes diabetes, that eventually becomes cancer. That's how it happens. It's not a chemical reaction. It's not a chemical imbalance. It's clusters of cells that we all have. Diabetes is the end game of a process that's already happening, and it's reversible. Heart disease is reversible. Cancer, guess what? I have it and you have it. We have the cells in our body right now. The statistics on cancer is that the rates have not changed since we started the war on cancer. So if the rates have not changed, what really in the end is the deciding factor between who kicks cancer, who never gets it in the first place, and who lingers and dies with it? And that's another one that, like, if I really wanted to go all the way in a darker direction, the cancer industry is a highly profitable one. It does not benefit the industry. It is an industry. It does not benefit the industry for us to be well and not need the care. The dollar sign over our head disappears when we no longer need care.
I think that's a great place to end it.
Yeah.
And think about, how can we no longer need care? I think that is what we're all working towards, at least those of us that are in the healthcare space and working with ill patients. How do we get you to that place where you no longer need our care? Like, I have done my job well if you don't need me anymore.
Exactly. And so this is, I think a place to end would be a term that I've coined locally, right, in myself. So we all know about how agriculture works, but many people, if they're not already affiliated with this word, don't know about permaculture. Right? Permaculture says that how we choose to create systems and environments, how we as humans control the environment, change it, if it's not taking into account every being and how it will affect every being, then it doesn't fit under the heading of permaculture. Permaculture is accounting for all possibilities, all beings, and moving from a space of honoring that every being has a right to live. And so it means that we can adjust and make changes, right? We can clear cut a forest, or we can plant crops. And sometimes we even need to interfere with an environment to make it a better environment for people. So here in Costa Rica, there are swaths of land that have become decimated from the cattle industry, And there are people coming in re-permaculturing these spaces. So it might mean that they have to cut certain things back or destroy certain things that are there so that they can actually grow what needs to grow that will create generations of good, as opposed to one growing season like agriculture. A lot of the agriculture, hey, no thank you. Dogs in heat. And so I call what you do, what I do, what this conversation is ideally creating a ripple of frequency of vibration in the world to put more in the direction of people permaculture. How can our health care be true care? How can our autonomy and our health and our freedom be true autonomy and health and freedom?
That is beautiful. People permaculture.
Okay, thank you.
Well, before we close the recording, how can people get a hold of you if they would or work with you?
Yeah, they can, if they'd like, they can email me directly. And so that's Aphrodite, APHRODTIE 2381@yahoo.com. If they want to see some of the things that I share on social media, because I do share about some of these topics, maybe not quite to the depth that we're discussing them. And they can also come and work with me if they'd like in several different ways. I do some group classes. I'm working on some group coaching. I still do melt and movement coaching remotely. Or if people want to come to Costa Rica, it's a beautiful place to get well, frankly. That's the other reason a lot of people are here. They can go to my Facebook. It's Monique Claudio. I think if you want to type in like the URL, it's monique.claudio/5. I actually don't know, but it'll be easy to find me. And then my Instagram is similar to my email. It's Aphrodite2381. And there are links on both of those to work directly with me. I have a questionnaire and an application if people want to do coaching with me, because I do whole person coaching. So it's uniquely designed, specialized, bespoke to each individual based on what their, core needs are. If someone wants more personal training, we can focus on that. If someone's looking more for empowerment coaching, boundary setting, like really looking inward, we can go there. Because I do work with plant medicines and a journey with that. I'm also working with integration from big transformative experiences or transitions in life. And I feel like this is a space a lot of people are in, like, okay, I'm getting off this medication, or I'm really, really reclaiming my health, but all this other stuff's coming up. What do I do with that? Right? Because when we change one thing, everything shifts. And so I would like to extend that offering of the class that I'm doing. It's called Radical Listening to Write Your Own Fairy Tale. And it's all about how we live our life. We get to choose. So many of us grew up with Disney. And we think that it's like, the prince is going to come and save us and we'll be happily ever after, but we're all waking up to that. It's not quite how it works. So this class is all about what gets in the way of listening, how can we cultivate deeper listening? And it's part of a series that I'm going to be doing on this overarching theme of writing your own fairy tale. So we'll be doing topics on inner child reparenting and how to play with the inner child, but all of these things that really need us to listen and come into presence so that we can live full, truly healthy lives, health-filled lives.
Awesome. Well, thank you so much. This conversation was just wonderful and beautiful, and I can't wait to share it with the world.
Thank you. Yeah, it's been a pleasure. I'm so grateful to drop in with you and to share this.
All right. With that, I will end the recording.
Okay.